Dissociative amnesia is a type of amnesia where you can't remember important information about your life, including things like your name, family or friends, and personal history. It can happen due to intense trauma or stress. Dissociative disorders are a type of mental illness. They are characterized by disconnect between things like your memories, identity, and surroundings. If you have a dissociative disorder, you may feel disconnected from the world that surrounds you. Periods of dissociation can last for hours or days, and in some cases can last longer, for weeks or months. There are a few different types of dissociative amnesia. Localized. This is where you cannot remember events from a specific time period. Generalized. This is a complete loss of memory, including things like identity and life history. It's very rare. In dissociative fugue, you forget most or all of your personal information and may wander or travel to places you wouldn't usually go. In longer lasting cases, you may even take on a whole new identity. If you have dissociative amnesia, you might forget things relating to personal history, identity, or events, but retain general information. In some types of amnesia, such as that associated with dementia, an individual has difficulty forming new memories. People with dissociative amnesia appear to be able to make new memories and retain cognitive functions. People with dissociative amnesia often seem to have little concern about their amnesia, whereas other kinds of memory loss can cause a person distress. Additionally, when dissociative amnesia subsides, most people recover their memories. Dissociative disorders such as dissociative amnesia are often linked to a specific traumatic or stressful life event, such as experiencing abuse or taking part in a military combat. People with dissociative amnesia may not remember information as it relates to this period of trauma. One example is a person who experienced abuse being unable to recall details or information from the time period when the abuse occurred. Many cases of dissociative amnesia are short, lasting hours or days. In some cases, they may last longer. Many times, memory loss can be explained by another medical condition. However, in people with dissociative amnesia, memory loss cannot be explained by other conditions, such as brain injury, stroke, or use of alcohol or drugs. Dissociative amnesia is linked to traumatic or intensely stressful events. Examples can include things like being in combat during a war, experiencing physical, emotional, or sexual abuse, being the victim of a crime or seeing a crime being committed, going through a natural disaster such as an earthquake or hurricane, undergoing a severe stress related to relationships, finances, or your job. There are several thoughts regarding why these events can lead to dissociative amnesia. It's likely that a complex combination of them play a role in the development of the condition. Dissociative amnesia results from the brain's attempts to cope with or protect you from painful memories by dissociating itself from a traumatic experience. The stress from traumatic events interferes with your brain's ability to retrieve personal memories related to that time. Some studies have suggested that genetics may play a role in the development of dissociative episodes. There are other conditions that can happen along with dissociative amnesia. These are called comorbid conditions and can include post-traumatic stress disorder, PTSD, depression, anxiety disorders, personality disorders, sleep disorders, alcohol or drug use disorders. To diagnose dissociative amnesia, a doctor will first take a thorough medical history and perform a physical examination. This can help them to rule out other causes of amnesia, such as illnesses, brain injury, effects of drugs and alcohol, If a physical cause of amnesia can be ruled out, you will be referred to a mental health specialist, such as a psychologist or psychiatrist. This is someone who is trained to identify and diagnose various mental illnesses. A psychological exam will be performed in order to gather information and get a good idea of your life experiences as well as your level of functioning. You will be asked about your symptoms as well as your behaviors, thoughts, and feelings. Relieving amnesia symptoms helps you to be able to connect with your environment and surroundings, helps you to learn to deal with traumatic or painful events in a safe way through learning a new life or coping skills. Treatment for dissociative amnesia include therapy and medications. Therapy can include things like talk therapy, cognitive behavioral therapy, and hypnosis. There are no medications to specifically treat dissociative amnesia. However, medications may be used to treat conditions that can occur along with dissociative amnesia, such as depression and anxiety disorders. Dissociative amnesia is typically short-lived. However, in some cases it can last for weeks or even months. It's also possible that you can have multiple episodes of dissociative amnesia over the course of your life. Overall, the outlook for dissociative amnesia is good. In most people, lost memories eventually return, sometimes without any treatment. Memory recovery can either occur suddenly or gradually over time. The prognosis for dissociative amnesia can vary depending on the type and severity of the amnesia, as well as your life situation. Seeking prompt treatment for dissociative amnesia and the conditions that can occur along with it can also significantly improve outlook. If you enjoyed this video, subscribe, like, share, and comment.